What are some big picture things in medicine in GI that just we should be aware of?
Some that come to mind, you mentioned colorectal cancer. Unfortunately, we're seeing that at a huge
Earlier.
increase in younger patients, which is
Mhm.
terrifying. I would say to take patient symptoms seriously in GI,
Mhm.
especially rectal bleeding. A lot of providers will, patients will say like, "Oh, I have a little bit of blood when I wipe," or "Oh, there's just a little bit of blood occasionally," and they'll say like, "Oh, okay, it's probably hemorrhoids, whatever." In my line of work, we take rectal bleeding very seriously. So if you come to my office and you're like, "I have a little bit of blood every once in a while." Again, I can pretty much know like it's probably hemorrhoids, but I'm not going to take that chance. Like you're going to get a colonoscopy because I'm not going to be the one that kind of misses that. Specific
Mhm.
things like rectal bleeding or unintentional weight loss, like if somebody comes and they say I'm losing weight and I don't know why, those are things that you don't ignore those.
Mhm.
Kind of more, I would say more general, which is it's funny, but I have this conversation so often is to ask patients seriously about their bowel movements because so many of the things that I manage, I can't even begin to tell you how many patients come into me and they've been into the ER 3 times with abdominal pain and they get CT scans and the CT scan is read as completely normal. And I look at the scan and within 30 seconds, I'm like, well, you're like super constipated and that's why you have pain, right? So not
Oh,
kind of digging into those things and saying like, okay, hey, like maybe this is it, right? Because patients come in and they're like, "Oh, I'm not constipated. I go every day." I'm like, just because you go every day doesn't mean you're not constipated. You can still have a crazy amount of stool in there, and that could still be causing your symptoms. And I tell people like the GI system is one giant tube. So everything that happens down below is going to affect everything that's happening up top. So if a patient comes in and they all of a sudden have worse reflux, are you pooping?